Dr. Allison Messina, she's with Johns Hopkins All Children's Hospital in St. Petersburg, and Dr. Victoria Selly, an emergency room medical director with Advent Health. Thank you all for joining us tonight. I would like to tell you first, this is an open and free forum where we talk as if we're just simply gathered around having a cup of coffee. There's no hand raising here to talk. It's an open forum. So please feel free to chime in, whether it's about factual evidence, your medical opinion, or even anecdotal. All of it can certainly help tonight as we're looking at COVID-19 in this current day and age. First question I would say it would be for all of you. But first I want to start with Dr. Selly here when we first asked this first question. Looking back on the weekly case numbers here, maybe just 6 weeks ago at 11,000 weekly cases, if I told you, hey, in a month we're going to set a record on several levels here, we're going to be over 100,000 weekly cases, record hospitalizations, kids getting sick and hospitalized, would you have believed that if I told you that just 6 weeks ago?
I think we were expecting some sort of increase and rise, but I don't think any of us have really anticipated the amount that we've been seeing in the last week, for sure.
Dr. Wilson, how about you?
Yeah, I think if you go back just 2 or 3 weeks ago, we were in a much different place. We were in a place where our hospital really did not have a lot of admitted COVID patients. The concern I think we had, though, was our vaccination numbers in this area had really flattened out. And we were seeing vaccine clinics that really didn't really have anybody coming to get vaccine. And so there was like this calm before the storm feeling that you're in this break from COVID, but you see everything going on around you in terms of normal life, and you see those vaccine numbers, and you kind of know the storm is coming.
Yeah, how about you, Kim? I mean, you work at the COVID unit at TGH. I know that you are really in the thick of it now. How are things there?
Definitely over these past 2 weeks, they've been challenging. The nurses are tired. Our patients are becoming more and more sick. It's happening quickly. And we always knew COVID was going to be a fluid, moving target as far as infection rate. But this is worse than the surge we had previously had. So we're getting tired.
Yeah, I would imagine so. Let's open this up for Dr. Messina here. The surge right now with the Delta variant is gaining momentum every single day. The numbers show that. By all indications, we're going to set another weekly record this Friday and maybe beat the daily record yet again along the way. What is causing this COVID strain to escalate so quickly this time around versus what many are calling old COVID back in this time in 2020?
Yeah, that's a great question. I think that the nature of the Delta variant is such that it is much more transmissible than the earlier strains of COVID that we saw earlier in the pandemic. And I think that's really the big difference that we're experiencing now that we weren't seeing before. It's just far more contagious this time.
Yeah, and we're hearing so much now about breakthrough cases. Is there a reason we're seeing more breakthrough cases? And is this concerning to any of you about how the vaccine is being perceived by some people, either vaccinated or unvaccinated? And we keep hearing about all these breakthrough cases. Is that concerning to any of you?
I think what we've noticed so far is that those that are breakthrough cases, somebody getting disease while they've had a vaccination, is very minimal. The number of cases that we're dealing with that are complicated and severe in the hospital are by far unvaccinated patients coming through.
Yeah, I want to echo that. We certainly recognize that there are, and I put this in quotes, breakthrough cases. And it's a little confusing, I know, when I put that in quotes, but the reason I do that is because if we go back to the original studies for these vaccines, the way they were studied was to demonstrate that people were not going to get sick, hospitalized, or even die from COVID. So far, whether it's the Pfizer, the Moderna, or the J&J vaccine, that is what we're seeing, is that the biggest thing that explains whether or not a person gets very sick from COVID or doesn't get very sick from COVID is whether or not that person is vaccinated. So it is true that we're seeing people who do have the vaccine still get COVID. We're seeing very few of those people become hospitalized. Now, the issue is that if we have lots and lots of people in this area who don't have the vaccine, and we have a thing like the Delta variant that spreads very easily, this means it's going to spread through all those people. And then even if I do have the vaccine, I have so many opportunities, probabilities of getting COVID because there's so much COVID around me. But I am protected from getting very sick. And that's what we're seeing, I think, at all the hospitals.
We're getting a question here from one of our viewers here tonight, Vanessa. She's asking, why are people who are vaccinated being told they don't have to quarantine if they're exposed? I'd ask that of Dr. Selly.
I would say that if people are exposed or if you have symptoms, we are still asking you to go home and quarantine. The same thing of our school-age children, and Dr. Messina can chime in. If they are exposed or if they present with symptoms, we're still asking them to stay home until they're clear. And that's what the CDC is still recommending at this point. So we have to be probably clear and ask a clarifying question if somebody's being told that.
Okay. I want to talk to all of you here, especially, Kim, Dr. Wilson, Dr. Messina, Dr. Selly. Working on hospital floors, you guys see patients on a daily basis or in close contact with doctors or nurses who are seeing what's going on with the Delta variant and the patients who are coming in. If you don't mind, I want to start with Dr. Messina here from Johns Hopkins All Children's Hospital. The Florida Department of Health reported over 10,000 new COVID cases last week in kids under the age of 12. That's on average about 1,500 cases a day. The surge is worse for kids 12 and up who are actually eligible to get this vaccine right now. 11,000 new cases last week alone. At your hospital, if the numbers I saw are correct, you saw about 11 cases back in June and now over 100 cases in the month of July. So when a child comes to the hospital with severe COVID symptoms, what does that experience look like for them? Are we talking ventilators, or are we talking more like IVs and medications?
So that's again, good question. And it's a bit of a complex answer. I would say that the majority of those patients that we diagnose are well enough to go home. Fortunately that has been the case throughout the pandemic. We know that in general, as a whole, it doesn't hit kids quite as hard as it hits adults. But when they do come in, what we're finding is their symptoms really run the gamut. Some of the kids, especially the older kids, and when I say older kids, I mean, sort of the older teenagers, they're the ones that we're finding the most severe disease in, by and large. The other thing that sets the kids up for severe disease is if they have any comorbidities, if they have any medical conditions at baseline. So those are the kids that we're most likely to see in the ICU on ventilators. A lot of the other children that we're seeing, yes, they may need IVs, they may need fluids, they may need to be watched on some oxygen on the floors, on the general floors, not the ICUs, for a time. But we're also seeing some, I would say, stranger symptoms. We're seeing, for example, kids with encephalitis, which is an inflammation of the brain and the lining of the brain. We're also seeing kids with MIS-C, which is the multisystem inflammatory disorder that they can get after COVID. So I would say that the kids that we're seeing have a variety of symptoms, and they really run the gamut from not that severe to very severe.
For us, we saw an early rise of RSV that came through, so we've had such a mix of symptoms in kids. We haven't had a ton of those sicker kids that Dr. Messina spoke about, but we already have had a few in our community, and what we've had to do, and they were adolescent age, as she mentioned as well, and then we have to then move them to our tertiary care center with one of our partners for further care. So the majority seem like they've been manageable, but we have had a few that are part of the scarier cases.
Mm-hmm. And I want to say the other thing that we have, unfortunately seen is when kids get sick in a family, there's usually other family members who are ill as well. And one of the most tragic things that we see is when kids come in and somebody in their life, a parent, a grandparent, might also be very sick or might also have died. We've seen that too, and it's very devastating for these kids. Not only the disease, but all of the repercussions of that disease running through their family. So it's a multifactorial toll, I think, that it's taking on our children.
Agreed.
Dr. Messina, I'm sorry, go right ahead.
No, I was just going to make a comment that one of the things that's been difficult is I know schools are getting ready to reopen and they're excited, the teachers are excited, the kids are excited, and we've had sort of a flood of, yes, we're opening, yes, we're going to welcome your kids back. And in the last 48 hours, I've had multiple schools send out notifications where they've taken a moment to pause about what open houses and reopening will look like. And I applaud them because I know that's a difficult decision, but I have 2 younger kids. And so any school that's going to take a moment and just pause about how they're going to reopen, I'm very grateful for. That means I know that they care about our kids like I care about my kids. So taking that pause and just looking at how they're going to have the reopening process, the open house process, and maybe if they're looking at mask wearing, I'm grateful if they're having those conversations for sure.
And I just want to piggyback on one thing you said, Dr. Messina, which I think is really important for people to understand, and that's that when there's a kid who's got COVID, there's also potentially a sick person at home, or perhaps a person at home who's an adult who got COVID and passed it to that kid. And what we know from the data from last school year, and what we know right now in a time period where school is not in session, is that adult outbreaks drive our school outbreaks. Now, if I go back 1 year ago right now, I was very worried that our public schools were going to drive a community outbreak. What I think we actually saw was the opposite happen, was that when we were getting high numbers in the community, we were seeing those in the school. We can expect the same thing in our schools right now. So I'm going to sound like a broken record here sometimes, but it's really not that complicated. That the best thing we can do right now to protect our kids who are going back to school is for the people who can get vaccinated, people 12 and over, and for adults to get vaccinated, to bring those numbers down in our entire community and help protect our kids who are going back into a classroom. If I said something that's different than what our expert pediatrician or infectious disease people want to say, please correct me. But that is my perception, I think, right now.
No, I would agree with you there. I think the most important thing is to drive down the amount of virus in our community as much as possible. And it doesn't really matter if it's an adult or a child. Less virus means that we're going to have less transmission, and less transmission is good for everyone. It's good for our medical system. It's good for our schools. It's good for our children, and it's good for all of the adults who won't get ill enough to have to go to the hospital.
This has been we've been talking about this for a year and a half, but now the Delta variant is ramping up. But the big concern, I think, for everybody these days is any parent who has a kid going back to school, especially those who are under 12 and can't get this vaccine, grandparents who have grandkids under the age of 12. This is certainly concerning as we're about to send our kids back to school next week. Myself, a parent of 3 small children. And we just had a question up there just a short time ago from one of the viewers who's watching tonight, saying, what about our unvaccinated kids? Are they safe to go back to school? And that is a question that a lot of parents, and myself included, that are grappling with right now. Is it safe to send our kids back to school? Does anybody have the answer to that question?
I don't have the answer. I want Dr. Messina to speak, but I know that the American Academy of Pediatrics is still recommending masks for those kids 2 and up. And so if our kids are going back to school, my kids are going to be wearing their masks. And I think our schools otherwise are really doing their best for some of the social distancing that they can. And I know that they've all advertised that they're doing their absolute best as far as hand washing, hygiene, and classroom cleanliness as well.
Dr. Messina?
Yeah, I would totally agree with that. I think the most important things that we can think about are the strategies that we do have to not only to keep our kids safe in school, but to keep them safe in the community as well. And those things are, if your child is old enough to be vaccinated and they are eligible for vaccination, that to consider vaccinating them. If they are younger, they should be masked. If they are in school or in an indoor space with other people that are not in your immediate family, you should be masked, whether you have had the vaccine or not. So when your child goes to school, the more kids in masks that are in school wearing masks, that's our best day. The masks help a ton, and they will help. And not only will they help the child in school, but they will also help your child if your child is unvaccinated when you go to the supermarket. Please make sure they wear a mask. That's really what we need to be doing. And then I think I think it was as Dr. Wilson said, and make sure that we're vaccinating everyone around them that we can. If you have an 8-year-old child, let's say, and everybody else in your house is over 12, make sure that everybody else is vaccinated if you can't vaccinate that child right now. And make sure that your kids are up to date on all their other vaccines. I don't want to lose sight of the fact that we don't know what's going to happen with flu this year. And so make sure your kids, all kids that are school age, are eligible to get their flu vaccine. So please make sure that happens.
Also getting another question from one of our viewers, Dawn. She said, can you please talk about the data that you're seeing on COVID survivors and how they are making out with this second wave of COVID? I don't know, Dr. Unash, would that be a question for you? If you can hear me.
Hey, have some trouble hearing. I'll tackle it while we wait for Dr. Unash a little bit, though. Early on, we saw some data regarding antibody levels after COVID and antibody levels after different dosing of the vaccine. And what we saw was that with COVID infection, you could get some antibody rise, but that antibody rise looked similar to having 1 dose of vaccine versus our patients who have 2 doses of vaccine have a 4 to 5-fold magnitude higher antibody rise, plus some memory immunity built into that. The other thing I want to make sure is clear at this point is that we are seeing cases, and this is different than what I would have said a year ago, or maybe even 6 or 7 months ago. We are seeing cases where people have had COVID previously and have COVID again and are still sick from COVID the second time. And that's different, I think, than what I would have said clinically maybe 6 or 7 months ago.
Yes,
And
I think
Tim could probably speak to this too from the JEDI or Dr. Unash, yeah.
Yes, you're absolutely right about that. It's been shown that the natural immunity tends to be not as effective in neutralizing the virus, and it also doesn't seem to last as long as the vaccination. But the plus side to that is the people who actually develop the greatest immune response are the people who have had the infection and then go through and get the vaccination. So if you've had the infection, don't think that you're immune, but if you are able to go and get vaccinated, at that point in time, you're going to be super immune compared to even the people who hadn't been exposed to the virus and had the infection before. And anecdotally, you're correct. I've been hearing stories about most of the people who are getting vaccinated who are getting developing COVID-19 or developing relatively mild infections or asymptomatic infections. But the people who have had the infection previously and have developed a natural immunity, I'm hearing a gamut everywhere from having a mild to asymptomatic infection all the way to having a disease that's even worse and the symptoms that are worse the second time around than it is the first time around. So I think it really, once again, behooves everybody to go ahead and get the vaccination.
Hey, Kim, let me ask you this. What are you and your nurses seeing there on the floor at Tampa General Hospital, especially in the COVID unit? What are you seeing in the patients now versus the patients that you were treating just 1 year ago in July or August of 2020? Because I want to be mindful of the fact that the burnout in the healthcare worker and the medical field was extremely high after the first round of COVID, where we think of old COVID back in 2020. But I got to imagine that that you guys are seeing something different now. Is that accurate?
Absolutely. So, our patients are on just a little bit of oxygen, and then, we're intubating them, and we're having to have those hard conversations with families about what are the next steps within just maybe 30 minutes to 40 minutes because they're just decompensating that much. I will agree that probably 90% of the patients we're seeing in the ICU right now are unvaccinated. They are 35 to 55 years old. And the ones who are vaccinated coming in that are having severe illness are transplant patients who unfortunately have a difficult time building up that immunity. So just to tag on to what everybody else has been saying, you know, even if you've been vaccinated, yes, the people around you need to be. And now more than ever, we need to be vigilant in protecting those who are immune compromised, our kids, our transplant patients, our cancer patients, because they're the ones being impacted. You know, it's not the ones who are generally healthy and vaccinated. It's those who are already sick and maybe vaccinated, and their family is just like, they feel like, well, we don't have to wear a mask, but you do. Despite being vaccinated, you have to protect those around you, and I think somewhere that message is being lost.
Yeah.
I agree, Kim. I think the bottom line is that the vaccine is the number one way to prevent the disease. All the medications we have, they come out weekly and monthly with something new that we are trying. None of them are curative. You're sitting in your ICU every day and we're trying new medications, we're trying new infusions. We're hoping to see if this reduces somebody's symptoms. But the number one bottom line is that the vaccine is the only way to be preventative in this measure.
Can I jump in that? Because I hear this a lot from patients and other people that they're concerned about a vaccine, they don't know what's in the vaccine, or that perhaps wasn't as studied as they would like it to be. This is important because I hear on the other side of that coin, well, if I get COVID, perhaps I can have a treatment. Most of the treatments we're using for COVID, while they are safe, we have enough data to tell us they're safe, we also don't know a lot about those treatments yet, comparatively speaking, to the vaccines. So even our monoclonal antibody infusions, right, which have emergency use authorization, we give quite a bit of, they are safe. There are still more things in those infusions, more synthetic things in those infusions than there are in a vaccine that's very well studied and very safe. So I just want to put that out there for people that if we're making risk calculations about which I want, do I want the treatments for COVID or a prevention for COVID? The prevention for COVID has way less side effects. We know what's in it. We have a multi-year history of what vaccine side effects look like, and we haven't really experienced big problems with that type of vaccine. Now, monoclonal antibodies are great. We want to make sure we get people who are not hospitalized monoclonal antibodies, but they are not without side effects themselves. So the best prevention and treatment you have is really one that's studied well with an emergency use authorization now with millions of people who've had these vaccines compared to treatment, just to keep that in mind. So I appreciate you bringing that up.
Yeah.
I would also like to jump in here about the concerns about the vaccine and what's in the vaccine. If you actually look at the virus and you break it down to its least common denominator, what the virus is a piece of RNA that's encapsulated in a protein and fat coating, a lipid coating. When that RNA, when that virus goes, it will bind to your cells using this spike protein that it has on the outside as part of that lipophilic lipoprotein coating, and it injects that RNA into your cells and then starts to replicate. Our vaccine, the mRNA vaccine, is just a small piece of that same RNA, which is the thing that it's only coding for is that spike protein and none of the other nasty stuff that lets the virus replicate. And it's encased in a lipid coat, very much the same as the natural virus. So there's nothing really special or, different about this vaccine, except it's with the vaccine, all you're getting is the important thing that induces the protective immunity and none of the nasty things that lets the virus replicate inside you. So given the choice between getting the vaccine, which is just that little piece of RNA with only the important stuff that gets you protected, and getting the whole virus, which also has all those nasty things that lets it replicate and kill your cells, I think the choice is pretty clear. You should just go with the vaccine.
We've been hearing so many times, though, from people who have vaccine hesitancy. If I'm honest here, I had vaccine hesitancy.
I see a question there that I could probably answer to. How do they know the difference between Delta and regular COVID?
Yep.
Well, the only way you can really tell the difference is by doing sequencing of the genes that are in the messenger RNA that's encoded in the virus itself. In my lab, we're just doing sequencing of the particular areas that are different between the regular variants that we've seen before and the Delta variants. But a lot of people will go ahead and sequence the entire genome and get the information from the entire genome. luckily now that's a fairly quick and efficient and cheap thing to do. So we're getting quite a bit of information now on large numbers of sequences that are coming out of the isolates.
I was just saying there earlier is that, going back to the vaccine and vaccine hesitancy, full transparency, I had it in the beginning. I was a little bit concerned about how quickly this vaccine was kind of pushed through. And I held back just a little bit on getting my vaccine. I kind of wanted to see other people be the canary in the coal mine, if you will. How do you answer people who are still hesitant, saying, it usually takes 7 to 10 years for a vaccine to get passed through? Why did this take so fast? So how did this happen so quickly? I don't trust it. How do you answer that?
So it's funny, I had a great conversation with my brother. We were sort of texting back and forth and chatting. He says, I'm just having a hard time. I asked one person and they said this answer, and another person said this answer. And I just have all these different questions. And he said, it's hard to figure out where to get the right information from and what to do. And I said, my brother, he's a boat captain. I would consider him like a boating and a fishing expert. I said, if I was looking to try to figure out what sort of boat motor to get, or if I was having a boat issue, I'm going to come to you. So you need to go to your local experts. I mean, that's why all of us are humbly sitting before you on this panel, because we want to help you. Go to your local experts. If you have questions, ask your primary care physician, call our clinics, call our ERs, call anyone you need to call that's a local expert in the medical field, so that you can get the right answers and so we can help you answer all your questions. So at the end of the day, you can feel like you made an informed decision rather than a decision out of fear.
Dr. Messina?
Yeah, what I usually like to remind people is that, when they say, well, the vaccine hasn't been out for very long, well, that's correct, but nor has the virus. So, when you ask the question, do we know the long-term effects of the vaccine? I say, well, we also don't know the long-term effects of the virus. And, what we do know about the vaccine is that at least the people that originally signed up for those trials for Pfizer, for Moderna, for J&J, they were vaccinated now over a year ago. And they're still being followed for, side effects and problems. And really, not a lot of big safety signals have come out of those groups. If you take all vaccines that were really ever made, most side effects that you see from vaccines happen within the first 6 to 8 weeks of being vaccinated. They don't usually happen years and years and years later. So why we would think that this one would do that is just, there's really not any one particular reason why we would think that this vaccine would do that. And as I said again, and I think as Dr. Unach was saying, the virus itself has mRNA that it gets, inserted into your cells. And it also does a whole bunch of other nasty things that the vaccine doesn't do at all. So I think that if you weigh those two, risk versus benefit, if you do that risk versus benefit calculation, it seems like the easy answer is the vaccine is a lot safer than tangling with this virus, which we know puts people in the ICU and has killed over 600,000 Americans. So that is not safe at all.
Yeah, and Jameson, I want to bring up too that, as an emergency medicine doctor, I have the privilege of taking care of whoever walks in the door. No politics, no conspiracies. It's just whatever a person feels that they want to present to me with and tell me about, I'm going to see. And so what happens because of that is if there are things going on in this community that are a healthcare risk, they show up in ERs very quickly. They're a signal. And, we've had these vaccines now since December. I was happy to be a canary. We've had these vaccines now since December. And, I have seen very little vaccine side effect. I have had 0 patients I've admitted to the hospital because of a vaccine side effect. 0. I occasionally get a patient who might feel a little anxious in the vaccine or have some soreness and want to have some questions that I'm happy to answer questions. I've had no serious side effects in the vaccine. So I think that's important. I see people every day and admit them to Kim's unit who are unvaccinated people who are very sick with COVID. And so I just want to make sure people understand that difference as well. I see somebody's asking, I'm just going to answer because I'm talking about vaccines anyway. Somebody's asking how long after they recover from COVID to get vaccinated. So I think it's important first to say that people who have had COVID should get vaccinated still. Once you're symptom free, you can move to vaccination unless you've had the monoclonal antibody infusions. And then I believe the recommendation is still 90 days after those monoclonal antibody infusions.
That's correct. Yes.
Thanks,
So a
Dr. Nash.
90-day wait. I ended up. I told you I had some vaccine hesitancy. I'm 45, and I should have gotten vaccinated as soon as my window opened up. I still waited a little bit longer, and unfortunately, at that time, I got COVID. It was not a pretty 2 weeks, and then it took me I waited about 7 to 8 weeks after first symptoms or to finally get my shot to then. So I didn't wait that 3 months, but my side effects were the minimal achiness the next day. Certain things.
Yeah,
like
just
that.
to clarify, the 3 months is only if you've had the infusions. If you didn't have medication, the 3 month window is not necessary. Just to clarify that.
And we have a viewer here, Kelly.
We have a question about vaccination while pregnant.
While pregnant, yeah. Yeah, I mean, I've heard a lot that it's okay, but anybody want to back me up here on that one?
I know the latest recommendations are that any pregnant women should also get vaccinated as well. There's also some evidence now that if you're vaccinated while you're pregnant, you may pass some of those protected antibodies onto your baby when your baby is born. So the most recent recommendations is yes, you should get vaccinated if you're pregnant. I know in the initial clinical trials, they tried to exclude any women who were pregnant or about to become pregnant, or were trying to get pregnant, but life being what it is, they still had a few hundred women who got pregnant during the course of this the clinical trial, and none of them had any complications as a result of getting vaccinated. They all gave birth to happy, healthy babies.
Right, and since that time, since the study, millions of women have been vaccinated. And of those millions and millions of women who have been vaccinated, many were pregnant, were trying to get pregnant, and they're still doing well by and large too. So that, I work with, we have a maternal fetal medicine department at my hospital, just as at Tampa General. And I know that the obstetricians there are recommending it to their pregnant patients. Typically, they're vaccinating them in the second trimester. And they are recommending that because, number one, the data that we see so far looks like it's quite safe, it's quite effective, and COVID is worse when you're pregnant. It causes more severe disease, and it can put the life of the mom and the infant at risk if they get sick. And unfortunately, even in our institution, we have seen women get very sick, and even a few who have passed away who were previously healthy. But when you get COVID when you're pregnant, it is a more severe disease.
Because the immune system is dropped in pregnant women, I would imagine.
Yeah, the pregnancy has some, it does have some interesting effects on the immune system, and it's kind of hard for me to go into all of them, but it does alter the immune system and the inflammatory cascade in certain ways, and they think that might have, might have some effect on why those women get sicker when they get COVID.
I guess I could ask Dr. Unash if you can hear me. We got a question there. Do you know when the
We have
vaccine?
a question about when the vaccine will be available for children under 12. I think that's a very good question and one that we can't really answer. The party line from the FDA has been they will approve the use of the vaccine for children under 12 sometime by mid-winter, whatever that means. But clearly it's going to be quite a bit after when schools are reopening. I know there's some pressure being put on the FDA to try and expedite that whole process, but I believe the FDA is taking a relatively conservative approach to approving the vaccine for children, even an emergency use authorization, because they are concerned about potential side effects in children where the disease can be less severe than it is in adults.
Okay, can we talk about booster shots here? Because I know a lot of people are starting to get to the tail end potentially of what they say might be that 9 months of the efficacy of the original shot, and then booster shots might come into play here. Are they going to be necessary, and how frequently will people need them? Because many people had side effects a day or two after getting the first and second shot, and the thought of getting another one is one that people might not be up for. And so I wonder about booster shots, because we're starting to hear conflicting information. Israel, Germany are starting to do booster shots or going for that third shot. What do we know at this point?
Well, right now they've not been approved for that, so there's not at least in the United States, the EUA does not extend to the third shot. I know that I believe it was Pfizer that said they are currently investigating what that third shot, the safety and efficacy of that third shot. So I think that a lot of questions have to be answered before the FDA will feel okay about approving that shot. I think that, it certainly makes sense that if you, as your immunity starts to wane, and they do, after every vaccine we get, you produce a lot of antibodies at first, and over time, they do decrease. I mean, and that's how your body works. That's not a surprise. When you get a booster, what it does is just it revs up your T cells. That's a blood cell that is very instrumental in helping the body produce a new burst of antibody. And the booster shot will kick that back into high gear again. And so that's really helpful if you encounter the virus and you don't want to get sick. But right now, I think that the issue is that the vaccinated people are still, by and large, not getting sick enough to be hospitalized and not dying. And so at this point, they're saying, well, the booster shot, how necessary is it at this point? But they are continuing to monitor what our response is, and they're continuing to monitor different variants. So we have the Delta variant right now. This virus mutates constantly. So at some point, we might have a variant that's, a little trickier, and maybe the booster will be needed at that time. So I think it's really just a wait and see. I mean, I couldn't tell you whether we're going to need a booster or how often we're going to need a booster yet. But the parameters that the scientists are looking at to answer that question, they are actively looking at. So we will know in time.
That said, I can tell you that Israel has authorized a booster shot for a third booster for the Pfizer vaccine for 60 and
Yes.
others who are at risk, who are immunocompromised or had a poor response to the first couple of shots as well. So there is some momentum moving in the direction
Yes.
of the boosters.
Yeah.
We're starting to get, Dr. Wilson here, we're starting to get several questions about which vaccine brand.
We've got some questions about
vaccines.
which vaccine brand is the best one to go with. Does anybody want to address that?
Johnson & Johnson's really been taking a real beating here lately.
Well, my opinion on the different types of vaccines, with the ones that you can get, it's the one that's the most convenient for you. Particularly with the Moderna and the Pfizer vaccines, I like to say that they're a lot like the difference between a red M&M and a green M&M. They all have the same chocolate on the inside. They all have the same important thing. It's just the color on the outside that's different. And that's pretty much true of the Moderna and the Pfizer vaccines. The Johnson & Johnson vaccine is a little bit different in terms of the way it was developed and the way that it introduces the RNA into your system. So I don't think it really matters. I think you want to go and get the one that you can get first and get the best.
I also want to, as we do, roundtables like this, it's important because I don't want to be dismissive here of some of the very real concerns for folks who, for whatever reason, think this virus and this vaccine are part of some, large-scale fraud or some type of conspiracy. And several social media posts seem to land right in their wheelhouse lately, just within the last week. The ones that really stand out to me have been posts about an outbreak of vaccinated people in a small town, Provincetown, Massachusetts, in the last couple of weeks, about 900 vaccinated people or so. And that kind of prolongs this this theory that the vaccine it doesn't help, it's no good. But you have posts like that have been going around and get passed around and shared several times. Another one was a woman in Palm Beach County that was shared thousands of times, saying nursing friends of hers told her that the only people coming into the hospital these days are people who are vaccinated. So I would imagine as health professionals, how do you reach those people who
Well-
just don't seem to be up for your message, for the message for vaccinations?
Yeah, so this is a little complicated because part of that is real information. Part of that is totally false information, and people are being asked to like digest all this information, make these kind of fairly difficult calculations. So the Provincetown data from the CDC basically showed that a group of people who were vaccinated, a large number of them got COVID, the Delta variant of COVID. Now, what's very interesting about this, though, is that only 5 out of over 300 people were sick enough to get hospitalized. So very low number of people getting hospitalized in that group. That's also the data that's told us that that Delta variant might have high amount of virus in it, even amongst vaccinated people like myself, which is why I'm going to wear a mask in a crowded indoor space in a place like Florida where we don't have many people vaccinated, because I don't want to, if I were asymptomatic from COVID, give COVID to somebody else. So that's a little complicated to dice out, but it's important because here's the weird part of that. The more people who get vaccinated, almost by definition, we'll see more cases in vaccinated people because that's all that's left, right? And so you go to a place like Massachusetts, in a small town with a high vaccination rate, then you're going to get cases and a breakout of vaccinated people, but they didn't get hospitalized. They were not very sick. And so please keep that in mind. Now, the other piece of that data is just false. This is data we can verify at our hospitals that people who are being admitted to the hospital is about 9-to-1 overall, 8-to-1 to 9-to-1 admitted, unvaccinated compared to vaccinated. And then in the ICU, it's over 9-to-1 unvaccinated to vaccinated. And this is known from the data from the studies. 8-fold protection of getting COVID, 25-fold protection of getting essentially put into the ICU if you have COVID. Sorry to take other speakers' time, but those are difficult Facebook posts or social memes I know that are going around.
It's okay, Jason. You're not on a timer. We're not going to drop the mic on you here at any point. You're fine.
Yeah, no, I was just actually going to agree. I would say to anybody here locally that's asking is that, Dr. Wilson, myself, and Kim, we are your boots on the ground folks that are seeing the patients when they come in. So we're the ones that can share with you that what we are seeing here are unvaccinated folks coming in. The ones that we are then handing off to Kim in the ICU are unvaccinated that are sicker. The few that we see coming in here that are getting COVID that are vaccinated are 1 out of 9, like you said.
And Nicole has a question here. She says, if you had a bad reaction to the flu vaccine, are you more likely to have a bad reaction?
My understanding, people coming in who are being hospitalized who have been vaccinated have other conditions, including immunosuppression. So they probably didn't respond really well to the vaccine in the first place.
That's right, Dr. Unash. Yeah, and that backs up what we're seeing at Tampa General Hospital, where we have a lot of transplant patients and we have a lot of just sicker patients in the community anyway. And even the fact that we're seeing maybe 8.5, up to 9 unvaccinated to vaccinated is probably even higher than the rest of the community because we have sicker people. And I see Nicole's question there about the flu vaccine, and one thing, she's asking if she had a reaction to the flu vaccine, if she would have a bad reaction to this vaccine. And the only recommendation against getting vaccinated with this vaccine is if you had an anaphylactic reaction to a previous vaccine. Anaphylaxis is like you have to come see me in the ER and we have to watch you in the hospital, give you epinephrine, or maybe put a tube in your mouth to help you breathe. It's not like, oh, this hurts, I don't like it, or I feel sore, I don't like shots. That's not anaphylaxis. And so we got to make sure we understand what, a bad reaction is. I'll let, some of the other doctors and other people here also talk about the nuances of that as well. Dr. Unash, you might be on mute.
Oh, I'm sorry, they're unmuted. Comparing the flu vaccine to the COVID vaccine is really comparing a horse-drawn cart to a Tesla, for example. The flu vaccine is a state-of-the-art technology circa 1956. Those vaccines are made by injecting live influenza virus into fertilized eggs and letting the chick embryo develop lots and lots of virus. They then take the egg white out there, which is loaded with active influenza virus, and inactivate it with formaldehyde, and that's what gets put into your arm. The COVID vaccine is a very highly refined, defined vaccine. As I said, it's just a small piece of the RNA without any of the bad stuff from the virus, encased in a lipid coat. And so you can obviously have a lot more, use a technical term here, schmutz, in the influenza vaccine that you could react to and have a bad reaction to than you would in the COVID vaccine. So just because you react to the that old vaccine doesn't mean anything with regard to what's likely to happen with you with the COVID vaccine.
Good question there by Nicole. Many people thought that COVID was slowly fading away as the restrictions and the vaccines were being made available. But first of all, we have to get through this wave of the Delta variant. But is there a possibility that another variant or another COVID spike could happen in the fall or the winter? And essentially everybody just wants to know, when does this end?
No, not only not possible, this is the reality we are facing. This is going to be this is it. This is the reality we're going to face for until we get vaccinated and get these numbers up, or reach some, potential theoretical herd immunity, I suppose. But we're going to keep on seeing strains and strains and strains until, we all get COVID or we all get vaccinated. And, I know we have a public health expert here, so I'll let him weigh in, but I think that's right.
Yeah, I mean, I guess the big fear here is eventually we may reach herd immunity, but the hard way.
Oh, Dr. You're on mute again.
I agree with you on that. We're going to see many more strains until we reach a herd immunity and this thing starts to subside. And that's not just herd immunity here in Florida or the United States. That's a herd immunity worldwide. This virus is rampaging across the world, and it has a whole lot of unvaccinated, naive people to feed off of still out there. That said, it's important to note that in any of the other previous epidemics that we've had, we would have never had any idea that we were getting these new strains developing at all. The technology that allows us to detect and follow these strains really has only been out there for the last 3 or 4 years. And so this is really the first epidemic that we've ever had where we could track basically in real time the development of new strains of any sort of a virus that's out there. And, of course, make new vaccines and new approaches to attacking these new strains in real time.
Yeah, and if people are wondering why we don't just wait around for this herd immunity theoretical possibility, well, we've actually eradicated previous significant threats to the human population through vaccination. That's how we got through them. And B, the problem is we are under stress right now as a healthcare system, as an economy, as a country. We got to end this, right? And so we can, we've gone from, like I said, 12 patients in a hospital to, Kev knows this very well, 110 or 100 and something patients in a hospital within a 2-week period of time. How many times can we, kind of go through those motions as a healthcare system and an economy that already has its own challenges to begin with? We got to get past this through vaccination.
Yeah, that's exactly right.
Yeah.
One of the comments I make is that basically masking and social distancing and all the other public health measures that we can take are really only hiding away, trying to hide yourself away to minimize the chances you're going to get infected. But when you get vaccinated, it prevents you from getting severe disease. So it's the be all and end all, and that's why we really want encourage people to get vaccinated.
The governor even mentioned the other day that they expected there to be this wave during the summertime. I don't think that anybody expected it to be this sharp. Am I accurate in that?
Agreed. I think we knew that we were going to have a spike, but it's happened so quickly. Everybody on this panel was spending time with our administration and our fellow colleagues to prepare. But it's happening at even a faster rate that we're trying to keep up with as far as managing patients within our ERs and our hospital. Definitely a spike rather than a nice curve.
Yes, it's. I have a question here whether the spike is bigger than was predicted. I think that depends on who you were talking to. I actually started to see evidence of this happening back around July 10th, and I started to really get concerned about what the numbers were doing and how fast things were growing. But one of the things that I can comment on with this whole Delta variant is that in other countries where we've seen this happen, we've seen very dramatic increases in the case numbers. But they tend to peak out fairly quickly and subside as quickly as well. So although this is really we're on the leading edge now, we're on the way up on this really steep wave. The models that I'm seeing are predicting that we're going to reach the peak of this within the next few weeks or so, and then we should start to see a real good and relatively fast decline in case numbers after that. But we're in for a rough 3 to 4 weeks, I think, folks. But after that, things should start to really improve.
I'd love to do a follow-up. I don't know if Dr. Yunash can hear me, but I do want to let people know who are watching that we're going to be taking your last questions here, or wrap up in the next few minutes as well. Because I don't know if some of you are listening there to Dr. Yunash's question or his statement there. He was saying we could start to see a little easing of this in the next 3 to 4 weeks. To the uneducated, how is that even possible when you just see this sharp incline just keep going and going? You see that here in the state of Florida, this virus has 8 million people to feed off of who are eligible to get the vaccine. What can actually slow this down in the next 3 to 4 weeks? Didn't know if Dr. Yunash. Thanks, Jason. I appreciate that.
I see some questions about why does it slow down and why does it edge off when there are so many people who are unvaccinated. Well, unfortunately, we're going to start to reach a large proportion of our population who are going to be immune, but they're going to get there the hard way. They're going to get there through the hospitals and through the ICUs. So we're having a lot of people out there who are getting naturally infected and are going to develop at least if not a really great immunity, at least a fairly substantial immunity as a result of becoming infected. So after a while, the virus is going to burn through, and it's just not going to have a lot of people that are left over that it can feed upon. And just like a forest fire, when it burns through, once the fuel is gone, it will subside on its own.
All right.
And then, but unlike the forest fire, we are literally sitting here with a bus to take you out of the forest fire right now. So we know your house is going to burn. We're telling you how to get in the bus and come with us so you don't burn in the forest fire. That's the vaccine right now.
Absolutely true.
We're hearing a lot of stories too of patients.
There's still time to get out of the way.
Yeah, there is. We're hearing stories of a lot of patients coming in unvaccinated to the ER who get there and are very remorseful, and at that point are asking to get the vaccine. Are these made up stories that we're kind of hearing along the way, or have some of you working there on the floor? Kim, I'd ask you that question. Have you gotten that, Dr. Selly? Have you gotten that type of statement from folks already?
For sure. We have patients coming in that are very remorseful. I had a patient the other day, actually. She came in very ill. She had COVID. She went from a nasal cannula, just oxygen in her nose, to having to put her on a mask. And I'm asking her, hey, did you get the vaccine? No, I didn't want it. And then we go through other questions. She's married. Her husband's admitted upstairs. And as her progression through her emergency department visit continued, she just looked at me finally and said, this is so bad. This is so bad. I did not expect this. And all I could do was tell her, I'm sorry, and we're going to do our best to get you through. But the look on her face was just so remorseful. She felt so bad. She goes, I just never expected to feel this bad. And that's as she's breathing through a mask. So,
Kim, how about you?
Yeah, I absolutely I agree. We just admitted a 42-year-old gentleman just the other day, and we asked, are you vaccinated? And he said, no, and he kind of chuckled. He said, I'm one of those conspiracy theorists. And he said, but boy, am I wishing I had done that now. Just how I feel. I have 6 kids. What happens if I'm not there for them? And so, that is the reality we see. And it's just, I think we've all said it. And I think people just need to understand that the little bit of soreness you're going to have after getting a shot is nothing compared to what this virus will do to you.
I guess, Kim, I can end on this one with you as well. I know that probably some of your nurses knew you were going to come do this roundtable tonight. Was there anything in particular that they wanted you to convey as you were doing this roundtable to folks who are listening to this? Some of the things that they've been seeing or dealing with. I know that they probably wanted you to be their voice tonight.
Yeah, I think that they would just echo on everything we've been saying about protect yourself, protect your family. We do have this opportunity to make things easier. And people are suffering, and it's needless, it's unnecessary. And so, just get vaccinated. It's just really that easy. Wear your mask, hand wash, and do all the things we've been talking about. And we truly will get through this together. But it's going to be rough. It's going to be a rough few weeks.
We've been through it before, and we can get through this again. And I think we've got the spirit to get through it. And it's just going to be a little hard to get there, but I know we can certainly do it. And when we do roundtables like this, it certainly helps. Yeah, I think the situation and answer some of those questions, and all of you here on our panel tonight have certainly done that. So thank you so much for your time joining us here on this COVID-19 roundtable we've had tonight. And thank you for our viewers joining us who may have had some questions. We certainly want to thank everyone for being part of that. If situations dictate, we'll have more of these along the way if we need to. But again, thank you to our panel. Thank you to our audience tonight.